Hey, 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 hey. Hey, 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 hey! You know, when you make that 911 call and you all show up at the door, can I get y'all to go, hey, 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 hey. We're here to save lives, and hopefully you took the right protocol to get us to your house, because if not, we're going to have a problem. But anyway, let me give a shout out to the interns first. I got Shroom over here on the engineer. He taking photography. He doing the listening. He doing a little bit of everything. I also got a new intern, which is Miss Campbell. Want to thank Coach Abassi. She don't want to be seen. That's why she got the microphone all up in her face and stuff. All right, but this is our intern number 2. We can't have enough interns here at Visions Unlimited Studios, because without you all, it wouldn't be in us. But I got 2 fantastic superheroes here this morning, and I'm going to let Mr. Pollard, my superhero, Ask Jen, so it don't sound like a cuss word on a Sunday, ASJN. That's Association of South Jackson Neighborhoods. I'm okay, Mr. Pollard?
Hey, good morning, Howard.
Go right ahead. Let them know who you are, sir, and what it is that you do in the city. One of the things that you do in the city.
Sure, and good morning to all of our viewers and listeners. I'm Jim Pollard. I am full-time with American Medical Response, the ambulance service for all of Hinds County, including the municipalities, and we operate in about 16 other counties in our state. We're a national firm. Our parent company owns us, the biggest provider of ambulance service in the U.S., plus one of the largest providers of helicopter and fixed wing emergency medical services in the country, all 50 states. It's a joy to be here. We're going to talk about some of the forms of service that AMR has conducted in Hinds County since we started serving the area in 1991, coming up on our 35th anniversary. Yes, indeed. And we'll also talk about, in particular, a new form of service that we're going to bring to the county as of this coming Tuesday, December 9th.
Mr. Paul, you're not over there praying on me while your eyes closed, are you?
No.
All right.
No.
Okay. All right. Okay.
No.
I just got you coming up now. You coming up. You coming up.
Sometimes it helps me think a little bit.
I got you. Okay. Well, I got to learn. I'm learning every time you come around
Right.
me.
There you go.
Would you please introduce the person the superhero to your right, sir?
This gentleman is RYAN Wilson. He is the top local manager for AMR, serving Hinds County and also Smith County. He is just an amazing guy to work with. Actually, report to him. He's my boss, and he could yes. And
He got his hands full.
Yeah.
Hands are full.
That's the truth.
He does, but I tell you, I'm ancient. I'm the resident fossil at our operation, and have had a fair number of bosses in my day, and I can't think of a better. The check's in the mail, the bonus, right?
Yeah. We'll see how this goes.
I love it.
A lot of pressure. Pressure bust a pipe and make a dime.
Right.
Exactly. And Ryan can tell you about his background in emergency medical services and how he advanced to this role of leading our entire team of EMTs and paramedics, call taker dispatchers, and so on at what's called AMR Central Mississippi.
Okay. Mr. Ryan, if I may, Mr. Wilson, Ryan Wilson, when he says you're leading a team, I'm talking about the entire team. How many people does that encompass, sir?
Yeah, so if we want to get down to it, so that's going to be 216 workers here for Hinds County.
Those are personalities, aren't they?
For sure.
Some of us got 2-3
216.
personalities inside of us.
That's it. Very
Okay.
unique folks that I couldn't do it without.
Okay, would you kind of give our listening and viewing audience, it's a pleasure to have two superheroes that make a huge, y'all amplify the word impact in our city. And hopefully after we finish listening and you all share, we'll have a better understanding of how we can assist when you all are serving us. Okay, go right ahead, sir.
Whether one is particularly religious or not, all of us in emergency medical services, and for that matter, all forms of public safety and public health, we think of our work as a calling, and it is a blessing to be able to help folks, in our instance, on the emergency side of our work, often with one foot in the grave and the other on a banana peel, some of the most horrible times of their lives, and we give our all. The job can be incredibly gratifying, but also extraordinarily frustrating, and we take care of our team.
Okay, go right ahead, sir.
Yeah, I think that's exactly right. You know, we were just saying we have 216 dedicated professionals that work here in Hinds County, and I think you know, like Jim said, it's a calling. You know, these people get up and come to work and work through often tough conditions, right? So an EMT and a paramedic, you know, every time they come to work and get on that ambulance, there's no telling what they're going to encounter. Every day's different. It could be hot, cold, raining. You can deal with people that maybe just need you as an ear, right? Or you can have somebody that's truly in a life or death, and you're trying to manage that and be professional and do what you know how to do. And so when we think of EMS, you know, one thing I've noticed over the years is that a lot of, especially people outside of the industry, they really think of it as, they think of the ambulance, right? They think of the dispatch when you call 911, and we often forget the people that are on that ambulance, and those are the ones that are really doing the work and are really dedicated to Hinds County.
So with that being said, Mr. Pollard, before we get too deep into this conversation, I can tell it's going to be a very interesting, informative, and a take action. Would you please start us off with some type of mind, food, and prayer, sir?
Indeed, and thank you for the opportunity. Heavenly Father, thank you more than we could ever say for the opportunity to serve others, to love and serve others. I believe, and I thank you, Heavenly Father, for instilling in me the belief that we are all here to make a difference for those others on the planet with us, fellow travelers. Thank you for having us here on this particular day, December 7th, which folks will remember is the anniversary of Pearl Harbor's tragedies in 1941. We remember with boundless gratitude all of our armed forces who gave so much of themselves, some who, hundreds of thousands, who gave their lives in defeating the enemies that we had at that time, and have lost more of our military since. We are grateful for the amazing blessings, the bounty of blessings, the abundance of blessings that we've all been recipients of, thanks to you, Heavenly Father. Enable us to be worthy of all of these many blessings, please. In your Son's name, Jesus Christ, we pray. Amen.
Amen.
Hey, amen. Before we move into our video to give a little synopsis of what we got going on with 911 nurse navigation, would you be so kind, intern number 2, you don't get a name until you come back. You got 30 days before you get your name back. But go right ahead. Just read that first little paragraph by 911.
911 nurse navigation programs are a type of specialized triage service for emergency calls. Primarily focusing on callers with non-life-threatening health concerns, a 911 dispatcher may transfer these calls to a licensed nurse navigator who then assesses the caller's symptoms using physician-approved protocols and helps guide them to the most appropriate level of care.
Okay. Do you want to chime in on that right quickly, Mr. Wilson? And I'm going to play the video in regards to that, because a lot of times I think there's three ways of listening. Number one, I ain't paying attention the first time you say something. Right? I really don't care. Number two, maybe there was a buzzword that caught my attention.
Right.
And then number three, I may be ready to receive some of it, but I didn't get all of it. So can you give a little reflection on what intern number two just spoke on?
Yeah, certainly. This is a program we're excited about. And she said a word that I think is really the key to this, which is appropriate care. This is AMR using its unique healthcare position in the community to come up with a new way that better meets the community's healthcare needs.
Okay. All right. Well, here we go. Let me see if I can get this video to play, and then we're going to get out the way, Mr. Pollard. We're going to get out the way. Here we go. Let's see.
It's a short video, about 3 minutes, 15 seconds, from DeKalb County, Georgia, where this program, Nurse Navigation, has been in effect for a couple of years now, Ryan?
Yeah, maybe 3 years, 2 or 3 years. So this program, it's been used in other parts of the country that have seen similar challenges, and has really shown to be so successful. But we're excited to bring it here. It's going to be the first of its kind in the state of Mississippi.
You guys keep talking until I can get this audio up.
Yeah, and so just kind of thinking about the history of it and where it came about. So AMR, GMR really came up with this program in 2018 to really address the changing environment that EMS works in. You know, we think of calling 911 and ambulances and emergency departments. The general public really just sees it as these resources are used when there's a true life threat, kind of like the movies, right? It's all car crashes and heart attacks and strokes. But in reality, what is an increasing number of callers that are really just seeking health care. So it might not be the stroke and the heart attack and the car accident. It might be they're trying to get treated for a fever or a toothache or an earache, even things like medication refills. And so our position in the community, we want to help people address those needs, but really for forever, our only option has been to send an ambulance to essentially transport you to the emergency department, where you have to, go there and wait, and it's tough. And for us using our resources, specifically the ambulance, we want to make sure ambulances are available for those really critical situations. And so this program came about to say, how can we better meet the needs of those, and I'll probably use this term more than once today, of low acuity, right? So when I say low acuity, those are kind of the individuals that don't have the immediate life threat. It is more along the lines of toothaches, earaches, leg pain, and things like that. And so we deployed this program to really, we're going to be that bridge, right? We're going to certainly take your call, help get an understanding of what you need. But let's see if there's a better way to do things, right? Let's see if there's a more appropriate way that we can get your healthcare needs met that maybe doesn't require an ambulance or an emergency department.
Your home's energy grid.
Here we go.
It lowers your energy bill by anywhere from 20% to 50%.
We don't want to talk about no energy bills. Hey guys, you should have put your thermostats on the right temperature. Don't blow that heat at 70, 75. You're going to pay for it in February.
When like many of you, he was hit with ridiculously high electricity bills.
New at 5 DeKalb County was second in the nation to put in a unique program. In late 2020, the program sent non-emergency calls to a line staffed by nurses and had more ambulances available for true emergencies. The county contacted 11 Alive about doing the story now, since they say many people don't know about it and due to no news coverage so far. 11 Alive's Don White got a look inside the county's 911 center and has more on how the program works.
People calling 911 for non-emergencies was affecting response times here in DeKalb County, but the county came up with a solution to improve public safety and get people the help they need.
DeKalb County 911, what is the address of your emergency?
Keeping the community safe.
Okay, and what's that address?
Is always the focus of DeKalb County's 911 dispatch center.
I think it's cutting edge.
What's known as the Nurse Navigator program.
The Nurse Navigator program is a program that was developed to assist callers with non-emergency incidents.
Sorry, can you repeat that address for verification, please?
All runs with the touch of a finger.
Each position has a button where they can do a one-button transfer into the Nurse Navigator.
What's the nearest intersecting street to that location? Okay, and which tow yard are you going to?
Through the program, DeKalb County dispatchers transfer certain calls to registered nurses on a line operated out of Texas if they think the call doesn't involve an actual emergency.
They're able to ask key questions. They're able to give advice over the phone, so they don't need an ambulance to respond. They can set up doctor's appointments.
We've been really excited about the option that it gives to our citizens.
DeKalb County Fire Rescue Chief Darnell Fulham says since the program launched 2 years ago, 8,000 calls have been transferred to the Nurse Navigator line, and they were able to determine ambulances or fire trucks weren't needed 31% of the time.
By not sending ambulances and fire trucks to calls where it's not necessary, we will see an improvement, not only in response time, but having those available units.
You're very welcome, and thank you for calling.
DeKalb County is the first county in Georgia to have the Nurse Navigator program, and Henry County recently signed on as well. In Tucker, I'm Dawn White, 11 Alive News.
Wow, that's a serious program. I got one question to ask Mr. Pollard, and I'm gonna get out the way. How many calls are we averaging on a daily basis? That's the first question. And how many of them are actual 911 super emergencies, and the other ones are kind of like minor?
So here in Hinds County, so obviously it kind of fluctuates, but we receive an average of between 150 and 180 calls a day.
By 911.
By 911. And thinking about this program, we've identified that up to 20% of all those calls would be appropriate for the nurse navigation program. Now, with that said, are we going to immediately redirect 20%? No, but we want to make that option available. And if thinking about the time and resource utilization, 20%, that's a lot of time. That's a lot of ambulance hours. That's a lot of resources. And so any that we can redirect is really beneficial. And kind of to put it in another perspective, the average, we call it time on task, right? So the average amount of time that an ambulance spends on a transport call is 1 hour and 25 minutes. And so the way we look at it is for every caller that uses this program, that's 1.5 hours of time that we get back. That's another 1.5 hours of ambulance availability that's in the community that can respond to those more critical calls.
And if I may, for the sake of clear, a more in-depth picture for our audience, you're saying presently and for many, many decades, if you remotely thought that you needed to go to needed some health care of any sort, a good many folks would call 911 simply to get into the healthcare system. They might not know how to navigate the healthcare system, or they may be without a primary care physician at a clinic, a whole host of reasons why they might call 911 for so-called low acuity conditions that don't warrant the immediate dispatch of an ambulance or the use of an ER. So tell us what happens now, and how is the call processed, Ryan, presently when you call 911, and what's going to change when the nurse navigation program goes into effect this Tuesday, December 9th.
Yeah, well, I think you brought up a good point up front. So we talked about the number of people that we think would be appropriate, the impact that it's going to have. But prior to moving forward with this program, we really had to take that extra step and say, all right, we see that these people are calling 911 for, we'll call it just minor medical needs, but why, right? Because I think if we don't understand the why, then we're kind of doing ourselves a disservice as to how do we best meet those needs. And what we really found is that it was really kind of a handful of reasons, and things like they're uninsured or underinsured. So maybe they don't have the resources available to feel like they can go to a healthcare clinic that's going to maybe require some kind of payment up front. We found that transportation or lack of transportation was another really common reason. Maybe you know that your doctor or local clinic can manage this, but you don't have a reliable way to get there or get back. And the third most common reason was really just difficulty navigating a complicated healthcare system. I work in healthcare. I've worked in healthcare for almost 20 years, and it still takes me, a minute sometimes to really try and understand the system as a whole to meet just, my personal needs. And so understanding that, nurse navigator is really just a really logical fit. And, people want, it's not that people want to call an ambulance and go to an emergency department and be there for 8, 10, 12 hours. It's just that they don't feel like they have options. And so with this program in place, that's really what it does, is it just provides options. So you're going to have someone that has a medical need. Let's say they have a fever, right? They have a fever, they just don't feel good. Maybe they have this time of year, the runny nose and cough. They want to get that addressed, but again, they feel like they don't have the resources up front to go to a clinic. They don't have a ride, or they just don't know the best place to go. So this person, they're going to call 911 just like they normally would. When they connect with one of our emergency medical dispatchers, they're going to follow the same process that they're following today. They're going to ask you a series of questions, and they're asking those questions so that we can get a sense of what's going on, what kind of resource do you need, and how much of that resource do you need. Now, when we get to the end of that, if you fall within sort of a predetermined category, meaning that if your complaint is one that we've already identified as one that we believe that we can help with nurse navigator
safely,
mm-hmm. Yep. You're going to be given the option, and I think that's the next important characteristic of this program, is that it's totally voluntary. We're not trying to take someone and force them down a path that they don't want. They will simply be given the option to say, hey, with what sounds like's going on, would you like to instead talk to a nurse who's going to spend a lot more time talking to you, getting an understanding of what you need. And then they have the ability to connect you with a local resource. And that's kind of the third characteristic that's important. This is a locally driven program. This is not, we're not trying to take some program that worked in Buffalo, New York, and make it work in Jackson, Mississippi, right? It's locally driven, and these nurses they're licensed nurses. They're licensed to work in the state of Mississippi. We have spent a lot of time before launching this program kind of compiling what resources do we have available here. And so they can say, hey, here's what seems to be going on. Here are some resources that are nearby. So it could be, say, a walk-in clinic, like a trust care. It could be an FQHC, like Jackson Hinds Comprehensive.
Just tell us what that acronym is.
Federally Qualified Health Center.
Mm-hmm.
So they are a medical clinic, but they operate as with the intent of providing health care to those that may be uninsured, underinsured, Medicaid, those types of that type of coverage. And so we can say, hey, here's some local resources. We know with your situation that they can help take care of you. Can we let us help you make an appointment? Let's say you're in that condition where transportation was the challenge. You just don't have a reliable way to get to and from that appointment. These nurse navigators can actually provide to you basically free of charge. If you say, hey, I'd really like to go to Jackson Hinds, but I don't have a way to get there. Well, they can help arrange for a ride that is at no cost to you to get you to and from that appointment. I mentioned earlier, it's not uncommon to get calls to 911 for individuals that are just out of their medication and they don't know how to get a refill. Traditionally, they would go to the emergency department to get a limited supply to hold them over. Well, now we can just help get you a ride to and from the pharmacy to refill your prescriptions. And
by ambulance?
No, so by something like rideshare. So
like a company like
Lyft, Uber,
Lyft. Mm-hmm. Yep. And who pays for that?
So that's a cost that we incur. So we cover that cost as the ambulance provider with the service.
All right. So quick review of what we've touched on so far. Presently, there are a great many folks who will call 911 because in some instances they don't know where else to turn for medical care, even for what even they may view as a situation that doesn't warrant everything that the emergency medical services folks can provide, whether it's ambulance folks or hospital folks. Mm-hmm. And this is an alternative now. When you call 911 and the local call taker at AMR interviews you and comes to see you as someone who might benefit more from another source of care other than EMS.
Yes, and that's right. And let's kind of clarify that because I think it's important. To say that we identify you as a good candidate for this program is not just the person you're talking to making a judgment call, right?
Mm-hmm.
So the first thing they're doing when they ask you those initial questions is they're using an established set of protocols to understand what's going on. And those protocols come from an organization called IAED. So these questions, how they're asked, the order they're asked, why they're asked. This is in fact an international standard that we're following, and it's also been approved by a local doctor to say, to kind of verify that yes, this is sort of the medical best practice, as it were, to make that determination.
And the call taker, based on those very systematic questions, which are rather like decision trees. If this is the answer, then you go to that next question or this other question. And those folks are highly experienced at these interviews to essentially get a picture of what the patient's primary complaints are.
Yeah, they're very experienced and they all carry credentials, right? So they have training, they have continuing education they have to do to be as proficient as possible in this. And then when we talk about, at the end of that systematic line of questioning, you come to a determination that may be appropriate for a nurse navigator. Those determinations as well have been reviewed ahead of time. They're reviewed by not only our physician and clinical team, but also by the physician that oversees the nurse navigator program as well. We want to make sure that we're not, say, including things that are, we're kind of on the fence about. We want to make sure that we're comfortable and it is safe, right? Everything we do in this program, the number one thing is patient safety. So we're making sure that it's safe to direct a person with that type of condition to nurse navigator. There's safety safety is kind of built into the program. So at any time, for example, let's say you get redirected to a nurse and they're kind of talking to you, and the more information they get, they're like, there might be a little bit more, right? So it started out as a fever and a cough. But now as they dig into it, well, you know, that cough has been going on for 3 days, and it's not just a cough; they're coughing up blood. They're, you know, it's built to identify that and immediately get that call back to us and an ambulance on the way.
Back to the local call taker here in Jackson.
Exactly, and get an ambulance dispatched immediately.
Now, the nurse navigator, similar to but broader than the interview process is in place for the local call taker, will, as I understand it, again, once the call comes over from the local communications center here at AMR to the nurse navigator, that nurse navigator will again interview the patient, and as you say, if there do appear to be elements in the call taker's condition that indeed warrant the immediate dispatch of an ambulance, the call comes back to us. But those questions are programmed into a whole database as to identifying whether a patient needs, this is a re-interview, right? And the call taker and the navigator will make certain that the caller, if the caller agrees, is provided a range of options for care appropriate to that condition the patient is suffering, and help guide the caller to a resource that will be highly specific for that condition. Now, a lot of folks, in all candor, calling 911, it's rather the default. It's rather established practice that if you need some medical care, and I don't have a primary physician, I might not even know what a primary physician is, I'm going to call 911 and I'll get an ambulance transport to the emergency department, regardless of condition. And so folks, right, are under the misconception that if I call 911 and get the ambulance transport to the hospital ER, I'm going to be seen faster. And nothing could be further from the truth.
Yes, so that is a really common misconception that we and in the industry, right, it's not unique to here necessarily, commonly run into, where, you know, you have a problem, you're trying to get better as quickly as you can, right? And so there's certainly been for a long time a misconception that if I arrive at the emergency department by an ambulance versus arriving in a car, that sort of elevates my severity and I'll get seen by a doctor quicker, and that is not the case at all. So even when you go in by ambulance, now certainly if it is a life threat,
sure,
we can navigate, you know, you're navigated through very quickly. But in most cases, you know, the only difference is we're just going in through a different door than someone that drives up. You're still talking to the same triage nurse when you arrive. They're still sort of following their established process, and nowhere in that is it, you know, did they come by ambulance or personal vehicle, and that makes a determination. So.
What's the consequence, Ryan, when someone calls 911 with what we call a low acuity medical condition, one that doesn't warrant, when viewed with medical objectivity, an immediate dispatch of an ambulance or the use of an ER? What are the consequences for the emergency patients, the patients who are suffering so-called high acuity conditions, the heart attacks, the strokes, the uncontrolled bleeding out in the community? Okay, so I'm a low acuity patient. I take an ambulance to the ER. Am I just suddenly dropped off at the ER and that ambulance goes back out on the street? What happens?
Yeah, so it kind of depends. So certainly from our side of it, sort of the consequence is at the end of the day, a community only has so many emergency resources available.
Mm-hmm.
There's a fixed number of ambulances available. And so, you know, that's obviously one of the driving forces behind bringing this program, is to say, you know, we have a fixed number. Obviously, we continue every day to add to that, but there's a realistic threshold, right? So part of wanting to add resources is also making sure the resources we have, are we using them appropriately? Are we using them efficiently? And so,
yeah, EMS does stand for emergency
Right.
medical services.
Yep.
Yeah.
So certainly when we send an ambulance to one of those low acuity calls, when they're engaged in that call, they're not available for any other calls.
The
right?
crew, you mean?
The crew. And so that is just fewer ambulance resources available and sort of waiting for one of those life threats. And so that's certainly the biggest, call it a consequence of that. And one of our main goals in this is to sort of add those hours back into the emergency system. It's certainly, when you get to the emergency department, it can cause several issues. So we do have protocols in place with most of the hospitals around here where we can take someone directly to the waiting room, which helps us get an ambulance back in service more quickly.
That's for stable folks who can walk. We help them get registered with the triage nurse and then escort them to the waiting room, and that crew can go back up for the next call, which could be another patient of low acuity under the current structure. And on the other hand, right, there's some patients who stay on our stretchers in the hallway for.
Yeah, there's definitely certain circumstances that sort of create that to where we don't physically have anywhere to put somebody. If anybody's been to an emergency department lately, there's a really high likelihood that you've seen, that it's just packed almost at all times. And thinking about a person that their ultimate goal is just to get quick health care, right?
Mm-hmm.
Unfortunately, you're actually oftentimes putting yourself in a system that actually delays the care, right? Because hospital emergency departments, it's not first come, first serve, and it's not, first served based on how you got there. It's based on severity, right?
Mm-hmm.
So if you're in there with something that is less severe, it's not uncommon these days for people to wait in the emergency department for 6, 8, 10 hours before they're actually seen by a doctor.
Either in the waiting room or potentially on the ambulance stretcher in a hallway, because even the waiting room is full. There are none of the cubicles for low acuity patients are available. That are all taken.
Yeah, so by the time you get discharged, you're spending, it can be 10 or greater hours. Whereas if the nurse navigation program can connect you with a local resource, that we can help you get a same day appointment at that clinic. You can go in, you can be in and out and have your treatment. That's much more timely than going to the emergency department. It's also much more cost effective for everyone involved.
Mr. Pollard, let me chime in right quickly because you got some other things you want to cover. Would you please do a recap for us, please, intern number 2, on the benefits of 911 nurse navigation?
Okay. These programs offer advantages for the patient, the EMS system, and the overall healthcare system. Tailored and appropriate care for patients ensures patients receive the right care at the right time in the right place. Connects patients to appropriate care options outside of the emergency room, such as urgent care, primary care, telehealth, virtual consults with a physician, or self-care instructions. Helps patients avoid unnecessary and costly emergency room visits or ambulance rides when their condition is not an emergency. Facilitates continuity of care by considering the patient's existing primary care provider and preferred provider networks. Optimization of emergency resources. Free ups ambulances and EMS personnel to focus on true life-threatening emergencies, improving response times for high acuity calls. Reduces strains and overcrowding on hospital emergency departments by diverting non-emergency cases. Allows EMS resources to be used more efficiently and appropriately for critical situations. Cost savings and lower healthcare costs for the patient and the healthcare system by avoiding expensive ambulance transports and unnecessary ED visits.
And go ahead, Ms. Paul.
But clarify for me real quickly. Suppose somebody says, I don't want to talk to some nurse, just send me an ambulance.
Yeah, this is a completely voluntary program, and if you're not interested, if it doesn't meet your needs, then we'll send an ambulance just like we normally would.
The core objectives of these programs is to modernize and improve emergency response for non-critical calls. Their main objectives are: 1, safety and triage, to use evidence-based clinical protocols to quickly and accurately screen a patient's condition to determine the appropriate level of care. 2, resource management, to divert low acuity 911 calls. Mr. Pollard, what's a low acuity? I got a cut finger.
Yes, uncontrollable bleeding qualifies for sending an ambulance, obviously. But if you have a minor wound of some sort, other than a puncture, most punctures do indeed need the care of an advanced EMT or a paramedic. Uncontrolled bleeding, you're a high acuity patient. You sliced your finger while cooking, and you're able to bandage it up locally. You don't think you're going to need any stitches.
Yeah.
We'll refer you to the nurse, and the nurse may say, here's how to take care of that relatively minor wound at home.
Okay.
Now, bear in mind that someone from the Nurse Navigation Center calls that patient back within 24 hours and checks to see how everything turned out, including whether the patient went to an urgent care clinic or a federally qualified health center.
So my listeners and my viewers, I just want us to have a clear understanding that we're not taking away the 911 system. We just want to make sure that we're getting the bang for the call so that those that are having those emergencies, because we're being stretched all over the city and all over the county.
Yeah, that's it. I mean, if you think about it, one of the challenges for EMS or any, you could even make the case for fire and police, anyone is empowered to use 911, right? And we want people to use 911. But obviously that can be a challenge when anyone is allowed, and we find these cases to say, hey, look, we're glad they called. We're glad they're seeking health care, but let's just make sure that we're helping to provide the most appropriate health care for, like you said, low acuity, which is minor cuts, basic fevers, toothaches, earaches, leg pain, things like that.
Objectives of 911 nurse navigation programs, and we're blessed to have that, so I want to thank you all for being the visionaries for that. 3, enhance patient navigation to provide a guided pathway to the most suitable medical resource available, considering location, time of day, and availability of care options. And 4, improved outcomes and efficiency to ensure patients receive prompt, appropriate, and here's a key word going into 2026, cost-effective care that leads to the best possible outcome, spiritually, physically, mentally, and financially.
Yes.
Do not go into the new year with a $10,000 bill because you calling the ER, because you calling 911 asking for an ambulance every time you got a little stomach disorder. Go right ahead, Mr. Paul.
Let's talk about the who pays for what.
Great.
Ryan, when I accept the local call takers' suggestion to talk with a nurse navigator, am I going to owe AMR some amount for talking with the nurse navigator?
Great question.
It is. So the answer is no. So this program is at no cost to the caller. If you choose to use this, accept our offer to talk to a nurse, go through the process, they help you make an appointment. They help you get a ride to and from. From beginning to end, there is no charge from us to use the program. The only cost would be, let's say you want to go to Trust Care, right? If Trust Care obviously charges you something for their services, that would be the cost. But as far as just using the program, talking with us, exploring options, even using the options, there is zero cost to the caller.
Do you have to have insurance to benefit from the nurse navigator services?
You don't, and I think that's important because thinking back, well, what's one of the reasons people tend to call 911 for minor needs and go to the emergency department? Well, a lot of them maybe fear they don't have any options because they don't have insurance, or they feel that they're underinsured. And so as you talk to the nurse and they're they trying to help match you with an appropriate resource, that's going to be one thing that they take into consideration, right? So let's say there's a clinic that only takes commercial insurance and you have Medicaid or you're uninsured. Well, they're not going to try and drive you there because that's not what's most appropriate, right? They're going to find the local resources that are designed to provide treatment for your situation.
Mr. Pollard, explain to me again, how does it work with me making a phone call and not having to come out of pocket for that phone call for Lyft, rideshare, or Uber? Are those the three components that we have access to?
Right. There's no cost for the 911 caller who agrees to talk with the nurse navigator for the conversation and the recommendations and the support that the nurse navigator provides. No cost for any of that. If transportation is needed and we send a Lyft or some other ride-sharing service, we pay for the round trip there. The only bills, the only invoices you'd receive would be from the actual provider of the health care, such as the urgent care clinic or Jackson Hinds. Now, bear in mind, no one has ever turned away, is what I've been educated about the program to know. No one's ever turned away for lack of insurance. The federally qualified healthcare centers such as Jackson Hinds and Central Mississippi Health Services as well, they have a sliding scale.
Yes.
They base their fees on what the patient's income is. And there are also about 4 clinics in the Jackson metro area, at least 4 based right in Hinds County that charge nothing.
Okay.
Nothing.
So a clear understanding is you don't put yourself in a position to call Lyft, rideshare, or Uber without going through the nursing navigation process. Is that correct?
Yeah, you can. So
please don't do that to yourself. Don't do that.
Yeah, if you follow through the process, if you called, work through, we help connect you with a resource and arrange for that, then that can be part of the complete care that we're offering.
So once again, that to qualify for that particular transportation, you have to go through the nurse navigation process.
By calling 911.
You gotta go. Don't just call and say, "Hey, I'm calling Uber. I need to get to the emergency room." No, don't do that. Please don't. All right, we want to pivot. We got about 10 minutes, Mr. Pollard. There's something else that you really want to get out there to the community that offers people, and they're sitting on the couch, that don't know what their opportunities are, an opportunity to not only enhance their lifestyle, but also the communities. Would you please, you and Mr. Ryan, share that with us?
One more quick thought about nurse navigation.
Okay, go right ahead, sir.
The cost difference between using an ambulance in a hospital emergency department and, say, going to an urgent care clinic, oh, my Lord.
Oh, great insight.
Wow, are you saving money and time? Okay, we have a program.
Wait, say that one more time, because I wasn't paying attention. Didn't apply to me. So tell me one more time.
The cost of going through the nurse navigator to get to, say, an urgent care clinic is, if you do get a bill, far, far lower to get a bill from an urgent care clinic than the combined cost of using an ambulance and a hospital emergency department. Far lower.
Okay. All right.
And you're leading us to, and thank you, Howard, to talking about a program that provides jobs for qualified folks that AMR has been running since 2019. And I'll say, Ryan, take it.
Yeah. Program called Earn While You Learn. This is probably one of the things we are most proud of that we started back in 2018, where we recognized where we needed to be in the future in terms of staffing, in terms of having qualified EMTs and paramedics in our community. And so we brought, again, another first-of-its-kind program in the state where, traditionally, if you wanted to become an EMT or paramedic, you went through a community college, you did the program, you got certified, and that's great, and that still exists, and we certainly encourage people to go through that program. But we wanted to just provide an alternative to make sure that we're like nurse navigator, let's make sure people have options, right? Because that's not always ideal for everyone.
Got to come up with the tuition and the books and all of that, all of those costs. Apply for financial aid. Yeah, when you go to the community colleges, you're paying them.
Yeah, yep. And so with our program, what we actually do is we take individuals from the local community, and that's probably one of the best things and most important things to us in the program, because we know the best EMS professionals are ones that are coming from our community. They have a vested interest in seeing their community being taken care of, and so we try and recruit from within Hinds County, but we take those individuals that want to become EMTs. We do have a kind of a screening process. You have to have a high school diploma or GED. You have to have a valid driver's license. You have to be able to pass the state's background check that they require for healthcare certifications.
Are we drug testing too?
We do drug testing.
Okay, we drug testing now. Give yourself about 6, 7, 8 months now to change the course, the trajectory of your life. Now, we just going to keep it real.
Yeah, for sure.
Community connections conversation, we just going to keep it real.
100%.
Don't allow your extracurricular activity to prevent you from having a lifestyle that will promote you into some other disciplinaries.
For sure.
All right. I just had to throw that out.
I
Thank you,
appreciate it.
Thank you, Mr. Ryan. Well, I don't want you smelling up like loud. Don't show up smelling like loud. Talking about I'm here to get in the program.
Exactly
all right.
That's exactly right. But the difference between our program and the traditional is we hire you as an employee and pay you to become an EMT, right? We pay you now. It is $10.50 an hour. You go to class for 10 weeks, 3 days a week, and at the end of it, you become an EMT, and that's a certification that goes with you the rest of your life.
On those 3 days, how many hours per day?
8 hours a day.
Okay. Mm-hmm. So you figure you're bringing home a few dollars to offset just learning to get more money.
That's exactly
more
right.
opportunity. Okay.
That's exactly right. So then as soon as you get it requires a national and a state certification, which obviously we, walk you through and help you get. But once you have it, then we guarantee you a full-time job. Your pay goes from $10.50 an hour to $15 an hour as soon as you get that license.
15 or 18?
I'm sorry, $18 an
Yeah.
hour.
Put another 3 on that for me, please. Mr.
My
Pollard,
goodness.
put another 3 on that. Mr. Pollard said we got 3 more
I sold
dollars.
it short, didn't I?
Yeah. Well, one of the beautiful things about the Earn While You Learn program, our paid in-house EMT training at AMR Central Mississippi, is that full-time job you're offered when you pass all of the requirements, including a national exam and receive your national and state certifications. We will pay you to start straight out of school after 10 weeks of training and some orientation and some supervised ride-alongs with experienced crews in actual patient care scenarios in the field. We'll pay you $42,000 a year before overtime.
Right.
And there's ample opportunity for overtime. And on top of that, after you've been with us for 6 months, what happens? What can you do after 6 months?
Yeah, so then you can become eligible. And, when we started this, we want to make sure that, this isn't just a job, right? Because, the conversation we had, well, you can go to Chick-fil-A for $15, you can do these. We want to make sure we're trying to help you create a career. And so while we teach the EMT program in-house, we also offer scholarships if you want to become an advanced EMT. If you want to become a paramedic, if you want to become a critical care paramedic, we can help you every step of the way.
Wow.
Both financially and both with just resources to help you get there.
We pay the community colleges for you to go on and get those higher levels of certification. And because you can then do more for the patient, your pay goes up substantially. Now, new paramedics straight out of school, you can become a paramedic within 2 years easily through us. You take the EMT basic course with us in-house, and then you can go on to advanced EMT or go straight to paramedic training. New paramedics straight out of school start with no experience as a paramedic start at about $57,000 a year.
Yes, $25 an hour.
Yeah, and our courses we teach it is 10 weeks. How long is it at the community college?
1 semester.
About 16 weeks.
And this is actually not only book theory, but hands-on experience too as well?
Both.
Okay.
Everything that you would learn at the community college to prepare for an EMS occupation, EMS job, we're going to cover in the 10 weeks. It's compressed. It's intense. And we are there with an extraordinary faculty, including our lead instructor. We've now, let's see, January 3rd, we're going to start at AMR here in Jackson, our 17th in-house paid EMT course.
Wow.
16 of them we've taught already. About what percentage of our EMTs?
Yeah, so at this point, about 40% of our clinical staff, right, so our EMTs, paramedics, advanced EMTs, have come through that program.
I got excited with that music. With that.
Yeah, and that's something we're so proud of because, again, thinking about
That's homegrown.
nearly half of our staff is coming more from the local community. They're more invested in what they're doing.
More tailored to our local operation.
So this is a fast track. And don't allow the challenges to impose upon you that it's still a process. And you've got people that have gone before you. And it sounds like you all really want people to be successful when they make this step, this obligation to themselves.
We do, and that's an important piece. And I think another part of it, too, is, this isn't designed. We don't want to see people, look, we want you to make EMS your career, and we want you to stay with us for 30 years.
Right, and you can go anywhere in the world with this.
But you know what? We respect the fact that people have different goals, and these certifications you're getting, those are yours. They're not tied to us, right? You can take them with you. And so we've seen so many people, ultimately they get their goal of, they want to be a nurse, and so they can take their education and experience and now become a nurse and have extra certifications. We've seen them become nurse practitioners and physician's assistants and even physicians.
Wow.
So if this is kind of a step in a bigger path, we would love to be a part of that step.
Right.
If you want to make this your career, we want that to happen for you too.
We just ask you to bring at least 2 or 3 people before you move on. Yeah, we need to bring us 2 or 3 more.
Yeah.
It's an incredible opportunity, not only the paid initial level of training, but then the fact that we cover the costs for the community college training for the higher levels of certification, which again increase your pay. It's not a job for everybody, but if you have any inclination, if it speaks to your soul to help other people in great need, this could be just what's right for you. And you could, some of our folks have been with us for 30 plus years. This occupation is like a great many others. You just stick with it for a substantial period of time. You can make a darn good living at it.
It beats sitting at the house on the couch saying, I don't have any opportunities out there in Jackson.
Yeah, and it's pretty interesting to see the reason people get into EMS and everybody's background is some of the most diverse that I've been around. I've been here with AMR Central Mississippi, and I'm a paramedic by trade, and I've been here for going on 18 years.
Hold on. I had them flown in from Nairobi, Kenya. All right, they got to get their work in. Go right ahead.
That's it. So we have a lot of folks that still work with us for even longer than that, 20, 25, 30 years.
So I'm convinced that this is what I need to do. First of all, how do we communicate, or how do we get more information about the program, the EMT program?
Oh, well, I think I have this number memorized by now. We are going to start, as I said, our 17th in-house paid EMT course on January 3rd. That class is essentially full. However, we project that we're going to have 2 more of these courses in 2026. And you can go ahead now and start to introduce yourself, to put yourself into the pool of potential candidates for admission to the course that will start in probably April, and then another one in August.
We'll do June, so we'll have January, then we'll have June because we try and catch graduating seniors.
Yeah, okay, thank you.
So you can come right out of high school and move right into this.
Absolutely.
Transition right in.
Absolutely.
You absolutely can.
And that telephone number is, Mr. Pollard?
You'll be talking, if you call or email, this person is Malcolm Robinson, M-A-L-C-O-L-M Robinson. He's our only EMT instructor. He's taught all of the 16 previous in-house paid EMT courses at AMR. And his email address is malcolm.robinson@gmr.net, not AMR.net. So it's Malcolm.Robinson at G as in goodness, golly gracious, at GMR.net. And his phone number is 601 919 7860. 601 919 7860. Malcolm Robinson.
And his office hours are from what time to what time, what days?
Can till can't. Seriously, he's like just about all of us. We're available 24/7. But he typically is in the office about 7. In his instance, he gets in pretty early, 7 to about 4:30.
Okay.
Monday through Friday. But gosh, the extra hours he puts in, so impressive.
Yeah, and if I can brag on it a little bit, so this class we're starting in January is actually going to be one of our biggest, where we have 22 new students that are going to be starting. And when you think about that, if we graduate 22 people in 10 months, that's that is the
10 weeks.
in 10
10
weeks.
weeks.
Thank you. That's enough personnel to staff 11 ambulances.
Mm.
So you know that really speaks to
That's
how
two.
important
That's
this
two to ambulance.
That's it.
Okay.
So
All
that
right.
really speaks to the importance and the impact that this program has.
All right, Mr. Wilson. In a recap, as far as it applies to the 911 nurse navigation, I can't thank you superheroes enough for what you do. I can't thank you enough for taking time out of your morning. I can't thank you enough for the time that you all have invested in our community. I can't thank you enough for the way sometimes we behave because we misunderstand how to, when we're having a little anxiety and a little anxiousness, we tend to take it a little bit further. So I just want to say thank you all. Give me 5 takeaways on the 911 nurse navigation that will be implemented December the 9th so that our viewers and listeners get a better understanding of how. You want to go first, Mr. Pollard?
Let me, if I may.
Okay.
Just to put the nurse navigation program in some context, nationwide ambulance services are and have been for many years in an environment where, there is a tremendous limitation on the number of EMTs, paramedics, ambulances, and so on for any community. Emergency medical resources are finite. You can run out of 911 response resources on the EMS side. You can, and it does happen because of the personnel shortage. And at the same time, there's a substantial percentage of 911 callers who can be safely treated by forms of in parts of the healthcare system that don't involve an ambulance or a hospital ER, and that's what the nurse navigator program is designed to address.
Yeah, no, you're exactly right. So thinking about kind of the key takeaways, I think this program is sort of one more step we're taking to redesign a healthcare system that has worked well in the past, but we have to acknowledge that the needs of our citizens evolve, and so we have to evolve with it. And so this is us taking the initiative and the steps to make sure that our service is meeting those current needs and not the needs of the past. It is a voluntary program, so we're not trying to force anybody into a situation they don't want to be in.
Not taking anything away from anybody.
Yeah, we're not taking any resources away. We're simply trying to provide options and make sure we're using our resources.
Community connections, conversations. Please share this. This program starts December the 9th. I think it's going to make a big impact on our city, but we have to be engaged, being informed, and being aware of the information and the process of using it to our best capabilities. Community connections, conversations with our very own Mr. Jim Pollard. Mr. Pollard, do I earn the right to get you back in about 3 months?
Howard, before I respond to that, folks, if you know Howard, you know this man is a community treasure, and you've thanked us for being here. We thank you for everything you do in the community with Association of South Jackson Neighborhoods, just as one example.
Yes, sir. Thank you.
And we're honored and, again, very grateful for this opportunity to talk with your audience today. Thank you.
Wait, and Mr. Ryan, hopefully you'll have some time to either send someone else out, a paramedic or something, and let them sit on the couch and just share their. I think the more we touch the program, the process, the energy, the more we may be able to understand. So we just want people to be on the same accord.
We would love to. Community education is critically important to everything we do.
And when you call an ambulance or the AMR, please, somebody go out and flag, put your red light bulb out. Make sure that you're visible. Make sure that the way to get to whoever it is that needs the emergency is clear. Back all the extra people out the way. You just need one person, hopefully, interacting with the EMTs. And let's just make sure we have a positive engagement. Don't make it personal. They're coming to assist. They're not coming to be a part of the problem. So we want to thank you all so much for connecting. Be sure to check in with us on Thursday. I'm going to let, where your microphone at, intern number 2? You about to get in trouble. You want to tell them thank you?
Thank you for being here today.
All right. And I want to thank you for being here today. Shroom, anything you want to say? And he don't do mushrooms? Come over here and tell him.
You got to say that. But it's been a real pleasure to have these two gentlemen up here, and just being here and listening is making a huge impact on me. So happy to be here.
Well, thank you.
Hey, you guys have a great Sunday. Know that you're superheroes wherever you are. You are very valuable. You're very capable. We are being attacked, and we must battle. So I'm going to finish on this little video, and you guys have a happy and safe Sunday, and love hard.
Happy holidays.
Ooh, look out. Happy holidays. Hey, 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 hey.